Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, October 7th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen Davilla, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Well, Brad, thank you and good afternoon. Our response to the COVID-19 resurgence is continuing, and we're working around the clock, the entire team, to stop the spread of the virus in our city. And by the entire team, I include all of the people of the City of Toronto as well. Dr. Davilla is presenting public health's modelling today to outline the possible scenarios we could be facing if interventions aren't taken in a timely manner. Last week, Toronto City Council voted to advise the Government of Ontario that it supports extending Regulation 719 through 2021. And this is the regulation that allows liquor sales licensees to continue to sell beer and wine and spirits as part of a food order for takeout or delivery. I'm glad to see the provincial government answer that call today made by ourselves and by others, and confirming that they're working to make this change permanent. They've clearly listened to many voices the Government of Ontario has, including ours, in confirming this step, which will help restaurants. It's the right thing to do right now, and people like it too, which is another important plus. It's been something that's been very popular with people. I've said a number of times how encouraged I am by discussions with our Deputy Prime Minister, Chrystia Freeland, about a planned new program to assist small businesses, including those in the hospitality and restaurant business, many of which have been directly affected by public health orders. I know the Government of Canada has been working very hard to finalize details of this program, and I would only urge them to move to further confirm its existence, the program, with as many details as possible as soon as they possibly can. I've been fighting for this support throughout because I recognize how heartbreaking and unfair it is that some businesses, by their very nature, are hurt by this virus more than others as a consequence of expert public health and medical advice rendered in the cause of stopping the spread of COVID-19. Finally, this weekend is Thanksgiving weekend. I want to thank people who are following public health advice and changing their plans to respect that advice and respect the times we're in and the challenge that we're facing. Your action will help us to stop the spread of COVID-19, help to keep people, including your own family members, healthy, and it will protect your loved ones, save their lives in some cases. I know this isn't the type of holiday that anyone would want, and that no amount of turkey or stuffing or pumpkin pie can replace the presence of your extended family members. But Dr. Davilla's advice, which she'll reiterate today, is very clear. Please do not hold big Thanksgiving gatherings. Please limit your Thanksgiving dinners and other gatherings to people that you live with under the same roof all of the time. And if you live alone, the safest option is to join with others virtually, and Dr. Davilla will talk about that as well. It is one more sacrifice that people are being asked to make during this crisis. And as our Prime Minister says, follow the rules, difficult as it may be at Thanksgiving, and that in turn will give us a shot at Christmas with all of the trimmings, including healthy family members. If you're really going to miss seeing Uncle Frank or Cousin Sally, if we follow the rules, we'll miss them at Thanksgiving, but we'll see them again in time for Christmas. I want to thank the vast majority of people for doing the right thing and for making their Thanksgiving plans accordingly, because from what I hear, that's exactly what people are doing. It doesn't mean you can't find ways to have a happy Thanksgiving, and I wish everyone a very happy Thanksgiving, as different as it may be this year. I'd like to invite Dr. Davilla now to offer her report.
Thank you, Mayor Tory, and good afternoon, everyone. Today, I am reporting 187 new COVID-19 infections in Toronto. The new count brings our total COVID-19 cases to 21,315. A total of 17,700 people have recovered from this virus. I want to talk about some other numbers today as well, including information relating to new statistics we're working on and some modeling projections about where infections may be heading this year and next. First, there is interest in figures relating to percent positivity by neighborhood in Toronto. Partial information circulated in social media recently. My team recently received preliminary data related to percent positivity by neighborhood. This is not our data. They are provided to us by partners at Public Health Ontario and require assessment before they can be made public. This is to ensure that findings extrapolated from it are disclosed in a meaningful and accurate way, and to ensure that there is no content that inadvertently discloses personal information. We currently post the number of cases and case rates by neighborhood. This additional content, once reviewed, will supplement that information. My team is working to make this information available soon. Once the most current data are ready for sharing, we will inform you. Keeping in mind that the percent positivity metric can reflect a high degree of virus spread or insufficient testing, I would say that from what I have seen of the data, the findings are consistent with things we already understand and have previously reported. Certain neighborhoods in Toronto, particularly in the northwest and the northeast of the city, have borne a heavy burden and paid a heavy price throughout the pandemic. We have been mindful of this for many months and worked with particular attention to support these neighborhoods through COVID-19. I've spoken previously about our community liaison teams who are working with these communities and with established community networks to increase our capacity to help the people who call these neighborhoods home to cope with the threat and spread of COVID-19. Concern for these neighborhoods, where multi-generational, multi-member families are common, was one of the motivators that led to the creation of the Voluntary Isolation Center to provide a place for people with COVID-19 to isolate safely. One well-established tool for measuring the rate of change of an outbreak and estimating what lies ahead is the effective reproductive number, also known as R. In the simplest terms, R, a measure of viral transmission, how many people one person on average will infect. So if the R is below 1, it means each new case is generating less than one new infection and that the outbreak will slowly die out. If the R value is at 1, the amount of illness in the community is stable. It isn't getting better, but it isn't getting worse. Anything above 1 means each infection is generating more than one new case, and the outbreak is growing. My team has calculated our current reproductive number, or R, at 1.2, so the outbreak is growing. The province, by comparison, estimates Toronto's R even higher, at 1.4, meaning they are estimating that the outbreak is growing even faster. Now, obviously, there is no such thing as a 0.2 or a 0.4 of an infection. You either have it or you don't. The R is an average of new infections from each current infection. But Toronto's R is still telling us that infections are increasing. Using the Canadian Institute for Health Information COVID-19 System Capacity Tool, here is what the future could be like with the reproductive numbers ranging from 1 to 1.25. I want to underscore that the numbers or counts are less important than the relative curve shapes and peaks. With our level of transmission, or an R of 1.2, we expect to see disease activity in the next few weeks of October that would exceed our April peak. But then, if the virus is left unchecked, Heading into November, things can get much worse. Infections continue to rise week over week, peaking between early March and early May 2021. Looking at the total simulated number of infections by the end of May 2021, we estimate that if the R goes up to 1.25, it would result in almost 4 times the number of infections compared to an R value of 1.1. Now, let's look at the model if we do take further action to arrest the spread of COVID-19. This figure shows that given an R of 1.2 in early October, and given that we know it takes about 4 weeks to see the benefits of interventions start to emerge, we can see that escalating public health measures dramatically drives transmissibility down. We modeled 3 different intervention dates, each with measures that drive the R number down to 0.9. And remember, when the R is below 1, it means that the virus is better controlled and the outbreak is headed towards dying out. The intervention dates we assumed for this model are the end of October, the end of November, and the end of December. So if we add measures to control COVID-19 spread at the end of October, by the end of May 2021, the total number of people infected would be 6 times lower compared to a scenario of taking no action. If actions weren't undertaken until the end of November, the total infections would be 3 times lower compared to taking no action. And if actions were implemented at the end of December, the latest dates simulated for intervention, this still cuts the total number of infections by May 2021 almost in half. But in any scenario, you aren't just passive observers. You do not need to wait to protect yourself and, by extension, everyone around you. Your actions, the choices you make, play a significant part in arresting and even reversing the spread of COVID-19. The virus will find it a lot harder to spread if you aren't doing things that help it to spread. That's why it is vital to think of your plans as a choice between things you need to do and things you want to do. That's where the steps for self-protection kick in. That's why keeping a distance of at least 6 feet from people you don't live with is so important. That's why wearing a mask as much as possible is so important. That's why washing your hands is so important. The virus will find it a lot harder to spread if we aren't doing things to help it spread. Thanksgiving weekend is just days away. I know my advice isn't easy to take, but it is the best course of action. Spend Thanksgiving this year with just the people you live with, under the same roof. If you live alone, the best thing to do is to connect with other people virtually. Yes, the situation is that serious. Some people will have serious mental health needs that mean that they must connect in person with others, despite the risks. If this is you, my advice is to meet the following conditions as much as you can. Meet with another person outside. Keep a distance of at least 6 feet at all times. Wear a mask. do not get together to eat or drink. This year, no one should make the mistake of being in a crowded room full of people they don't live with. It just isn't worth it. Believe me, I know, I really do know that this is a huge ask. No one wants to imagine the worst could happen as a result of a family holiday. But I imagine many of the people in Toronto thought something similar before they began the frightening and sometimes harrowing experience of battling this illness. I said on Monday what I'll say again today. I would much rather you do Thanksgiving differently this year than look back at this year in the future and wish you had. With that, I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. Davilla, and good afternoon. Today is the 211th day of continuous Emergency Operations Center operations. Our EOC continues to operate, and our critical and essential services are being provided without interruption. Our team remains hard at work, both implementing and continuing to refine our COVID-19 resurgence plans in response to the rapidly evolving situation in Toronto. From the outset of COVID-19, we have been prepared to respond as required in order to save lives and prevent our healthcare systems from becoming overwhelmed. We have developed comprehensive resurgence plans that, like our COVID-19 incident management system, are both scalable and nimble. The implementation of these plans and the continuing evolution of planning operations remain top priorities for our EOC and for each of our City of Toronto teams. Our COVID-19 Strategic Command Team is updated on resurgence planning operations daily, and decisions are made in response to emerging public health advice, direction, and guidance. As the resurgence of COVID-19 continues to evolve, so will the actions that we take in response. As you know, PPE has been a challenge throughout the COVID-19 pandemic and continues to be another top priority for our EOC and PPE task force. At present, our PPE levels remain stable, and our team continues to work hard to maintain the equipment that we need on a go-forward basis. Based on current consumption rates, our PPE inventory levels are as follows: a 72-day supply of N95 respirators, a 588-day supply of surgical masks, a 307-day supply of isolation gowns, a 760-day supply of face shields, and between a 106 and 1,220-day supply of disposable gloves, depending on the specific model. Over the last 2 days, our enforcement teams have issued 7 notices and 2 tickets relating to business operations and 2 tickets relating to activities in parks. 10 notices and 1 ticket have also been issued related to private gatherings. In total, our COVID-19 enforcement team has issued 1,517 tickets to date. Maintaining compliance with these important public health measures is critical to controlling the spread of COVID-19 in our city. Complaints with respect to gatherings or other COVID-19 related orders should be submitted to the city via 311. I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. And as always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We have a number of staff on the line to answer specific questions any reporter may have, including staff from Shelter Support and Housing, Transportation, Municipal Licensing and Standards, Long-Term Care, Parks, Forestry and Recreation, and the Toronto Police Service. First up is Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thank you very much. Dr. Davilla, I do have a question with regards to business, but I want to go to start off with these predictions. I'm just trying to kind of, can you explain in a kind of in a way, we already have a lot of protocols in place, and so, and people are recovering in a sense, and so I'm just curious as to where are the protocols failing, is I'm trying to get the idea of these predictions that we're making, and what has to be done about it, because things are much different now than they were in the spring when this was coming up. So can you just kind of reiterate simply where we're failing here?
So, Lucas, I think you ask a very important question, and I'm not sure that it can be very simply answered because the situation is constantly changing. What we were trying to do in respect of showing these models is to give people a sense as to what the potential trajectories, what's the future, or what could the future look like, depending on how much transmission of virus there is in our community. And at the end of the day, the level of virus transmission is up to all of us. We know how the virus transmits. We know how it spreads, and it spreads from person to person in close contact with each other through the droplets that you put out when you talk or breathe or sing or shout. This is how it works. So what we were trying to do with these models is to demonstrate that at different levels of virus transmission, you will end up with different outcomes in terms of active infections as we count them up over time, leading all the way up to May 2021. So it's up to us to make sure that we're doing the best we can, us in government and the population as a whole in their daily lives as they make choices around their activities, to do what we can to reduce virus spread by keeping our distance as much as possible, wearing masks, washing hands, and of course, staying home when you're unwell. So I think that's really what the purpose of the modeling is, to demonstrate that point.
And Doctor, I apologize for stumbling through that question. And in terms of the business side, I did want to reiterate something that we heard after the push to prohibit indoor dining, the fitness classes. I did want to paraphrase something we heard from one business owner that, quote, after that, the decrease in our business was significant. This is a restaurant owner. Just those warnings, when there wasn't even a shutdown, but just the warnings have kept people out of our businesses, and that's a lot of people's businesses, end quote. So when you hear that, and I'm sure you hear this a lot, but when you hear even just the warning is having an impact on people's livelihoods, what's your response to that concern?
So, Lucas, I think especially as we've gotten to this point in the pandemic, where we're trying to balance reopening with resurgence, this is certainly a concern that we've heard. And what I do is try to bring us back to what are our goals? What are we trying to do in respect of our response to the COVID-19 outbreak? And fundamentally, it is about absolutely saving lives and reducing the negative impact of COVID-19 on the health of our city. We want to make sure that we're doing our best to protect our healthcare system so that it's available to all of us in respect of COVID-19 and in respect of all the other medical conditions that come up. But also we're trying to make sure that we're mitigating the impact, the broader impacts of COVID-19 on all other aspects of health, our social lives, and our economy, because those elements are also important to health. This is a very, very difficult balance to strike. But when I look at all the evidence that's out there, we know that the better we can bring the virus under control, the better that we can bring transmission of virus under control earlier, faster, and harder within the resurgence period, the sooner we can get back to regular activities and be effective in terms of achieving all those objectives, not just reducing the direct impacts of COVID-19 on our health, but also reducing the impact of COVID-19 and control measures on all those other broader aspects of health. And, I'm sure the mayor will have comments to make about this, but certainly I know the mayor has been working very hard on this along with his other partners at other levels of government to do the best we can to protect businesses and people from the negative impacts of COVID-19, protecting livelihoods. Perhaps I'll turn that over to the mayor.
Well, I will just say that I'm heartened by the announcement made by the province today with some assistance for things like PPE to smaller businesses, but I'm especially encouraged by the conversations I've had, as I've said, with Deputy Prime Minister Freeland, and I just would hope that, knowing they have to sort out a lot of details and make sure the program works quickly once it's unveiled, and part of it is to be much more streamlined than before, that they can move forward with this as quickly as possible, because we know these businesses are hurting. And we know that as time goes on, they may hurt more. But it doesn't mean that you should abandon, things that we're told by the medical and scientific experts are the right thing to do to stop the spread. So I think this program will be extremely helpful and will be well received from what I know of it.
Okay, thank you, Lucas, for that. Next, we go to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. Davilla, last Friday, you gave us those numbers regarding community outbreak and the connection between restaurants and bars, and you put it at 44%. And that is a figure that Premier Doug Ford has said is not strong enough to warrant him to close or to grant your wish. I'm wondering, since we've now passed the following week, if you can give us an update on what that figure is at in regards to September 27th to October 3rd, and if it got better or worse in relation to those settings.
So thanks, Matt. Appreciate the question. So you're quite right. The data that we provided were for a particular week in time, and it was the week of September 20th to 26th, if I remember correctly. I don't have the current data in front of me at this moment in time, but I would say this. When we look at the experiences from other jurisdictions that are a little ahead of us in respect of their outbreaks and their COVID-19 situations, we know that when it comes to reducing transmission, right, and really controlling COVID-19 and its negative impact on a community, what really needs to be done is preventing the likelihood that you get non-essential interaction between individuals, especially in closed settings with close contact where it's difficult to use a mask or to maintain physical distancing. So we know that these kinds of circumstances arise when we have indoor service in bars and restaurants, for example. But there are a number of other indoor settings where this is problematic, and that's what we've seen not only here in Toronto, but in other jurisdictions throughout Ontario and around the world. Hence, we're looking at actions that can actually control COVID-19 and prevent COVID-19 infections from starting in the first place, so that we can do the very best we can to protect the health of the city and the residents of Toronto.
And thank you. In regards to the projections that you were listing with the reproduction number, you talked about actions that both individuals and the government can take. I'm just wondering, based on what you're seeing in those reproductive numbers, is there anything in addition to the restrictions that you asked for on Friday that you were looking for to try to get that number down?
So, thinking about the modeling predictions, you're right. They talk about certain reproductive number values, certain values of R. And really what we did was we modeled different levels of R and what that means in terms of infections. What actions are required in order to reduce the level of R, in order to reduce the transmissibility of the virus, are those that we've just spoken about. The kinds of things that actually reduce the likelihood that people come into close contact with each other, in closed environments, and where they're not able to effectively wear a mask or physically distance appropriately. And that will change over time, and it will change from jurisdiction to jurisdiction. That's why we're constantly asking people to really think about their activities and to think about the choices that they're making, right? Do you really need to do that activity, or is it just something that you want to do and that you'd prefer to do? For those things that are not absolutely necessary, we would ask people to find safer ways to engage in those activities, virtually being the best option. And if that's not an option, to try to do something outdoors and to maintain physical distance and to wear masks. This is what we can all do to bring the level of virus spread in our community down and to reduce the impact of COVID-19 so that we can, get on with restoring our city and managing as best we can while we're waiting for effective treatments and an effective vaccine against this disease.
Okay, thank you. We go next to Lauren Pelly from CBC News. Lauren, go ahead, please.
Dr. Davilla, just looking at the second chart you showed, it almost looks like if you start interventions into November or December, by that point it's too late to prevent this very large surge of cases that you're showing. Is that a good characterization? Like, is that too late to be doing anything at that point?
I think, Lauren, the better way to characterize this is, and this is also borne out in the experiences of other jurisdictions, the earlier you intervene, the better the outcomes in terms of active infections and the numbers that are generated thereafter. It's that simple.
And looking to this weekend now, some physicians are saying that Thanksgiving could be particularly challenging with university students coming and going. We know there's a lot who would be coming back to Toronto potentially if they're not choosing to stay on campus. One doctor today, expressed concern we could see super spreading type events from this, being the first holiday in a colder temperature where people would be potentially gathering indoors. Looking at all the numbers that you're showing today, it seems like, Thanksgiving is just obviously one piece of that, but how much do you worry right now that if people don't heed the advice that we could see, as someone suggested, super spreading events from this?
Well, I think that's always at issue, and it's certainly always a risk given how this particular disease spreads. More close interaction with people that you don't regularly live with under the same roof gives rise to the potential for transmission of COVID-19. It's that simple. That's why my advice is that, look, this is really, really difficult. And I really do feel for all of us who are stuck in this position. But please, the best thing that we can do right now is to keep our Thanksgiving celebrations and limit our interactions for Thanksgiving, our celebrations of Thanksgiving, such that we are only celebrating with those who we live with regularly under the same roof. I know that this is a very, very difficult thing to do for many people. I feel it too. I am in the same boat as well. But it is the right thing to do. It's the best thing we can do for ourselves and for our community. And I think you've just heard the mayor say, and echoing comments from the Prime Minister, that the more we are able to do this now, the better, a shot we have at enjoying other celebrations later on this year, perhaps in a fashion more akin to what we're used to. But please, I would just ask everybody, keep the Thanksgiving celebrations to your own household for this year. I completely respect and appreciate that there are some people who have significant mental health issues and that they require in-person connection, with others, despite the risks. But even in those circumstances, you'll see that I've been very, very clear. Limit those interactions. Try to keep them outdoors. Keep them outdoors as much as possible. Keep a minimum of 6 feet distance. Wear your mask, and do not eat or drink. Those give together. These are the circumstances that give rise to the risk for virus spread, and that's exactly what we're trying to avoid at this point.
Okay, thank you. We go next to Dave Woodward from Global News Radio. Dave, go ahead, please.
Good afternoon. Thank you. The Premier, during his news conference this afternoon, says he doesn't think that the entire restaurant bar industry should be punished for the few bad actors in the city. Do you think that targeting the bad actors would be enough?
So I take it that's a question for me?
Yes.
Okay. I appreciate that sentiment, and I recognize that, there are different circumstances all around the province. And what we're seeing here in Toronto may not really reflect what's happening elsewhere. What I can say about what's happening here in Toronto is that we are seeing significant COVID-19 activity. And we have been trying our very, very best to manage this balance between reopening and recognizing that that reopening would give rise to increased social interaction between people and therefore increase the risk of COVID-19 activity. This is a very, very delicate balance to strike. I don't think there are any simple answers here. And in fact, when you look all around the world, everyone has struggled to a certain extent with this because this is the first time we have all been through this kind of resurgence. None of us have had to be here before. So what we're trying to do here is to balance out, right? Making sure that we're doing what's necessary to limit COVID-19 spread and to limit the direct impact of COVID-19 on the health of our population, and as well make sure that those COVID-19 control measures and their impact is mitigated on the rest of the population. We know that these control measures do have some negative impacts in respect of business and employment. That's patently clear to us. You've heard the mayor comment on how many businesses are hurting, and there are people who are hurting. That's why I do look to the mayor and to other levels of government to do the best that they can in order to account for the negative impacts that are the result of COVID-19 control measures. But I will emphasize again, the experience from other jurisdictions is such that the earlier we intervene, the lesser the impact of COVID-19 on the health of the community, and the shorter the duration of the control measures that are required. It's a pretty simple calculus, although it is a painful one, and I completely recognize that. We have to think about health in all aspects, and I don't know whether the mayor has any further comments he'd like to make on that, but it is about establishing this balance, and it is a very difficult balance to strike. That's why we're asking every single person, every single Torontonian, to really think about their choices, to think about what they're doing, what actions they're choosing to take, which ones are absolutely necessary, and which ones are just, want to do's rather than need to do's.
I'll only add to that, and I've said it many, many times over the last 6 or 7 months. The discussions we have every single day out of the sight of the cameras and everybody else are agonizing discussions every day because you're going through, based on expert advice, you're going through then having to make choices about that advice. I ask a lot of questions, as do my colleagues at the command table that we sit at every single morning, and those questions are always about the consequences, the benefits and the negative consequences. And it is agonizing simply because there is no easy answer to this, and you have to rely on our experts to make sure they can offer consolidated advice to us, and that's what everybody's been working on for the last few days, and then for that advice to be offered. And I think we've done well in this country and in this city by making sure we accept that advice once it's been discussed and questioned and tested, because we've seen what can happen when you have politicians who substitute their judgment for that of people who are trained to look at this information and to tell us how we can minimize the illness and loss of life that would result from not doing anything or from doing the wrong thing, as it were.
Thank you. And Dr. Davilla, follow up. If the province decides they come back and say that, no, the city is not allowed to close indoor dining spaces for the 4 weeks, what is your plan B? What kind of things would you bring in to try to limit the spread?
So that's something that we're always considering. What is the next best course of action given the circumstances that we face? So I don't have anything new to report at this stage in time, but I will say this. It is responsible practice to constantly be assessing the situation and to think about what are the next best steps, given the circumstances, given what we see on the ground, given the context, given the environment. That is the constant concern, certainly of me and the team at Toronto Public Health as we seek to respond to COVID-19. I have no doubt that this is also the constant concern of our provincial counterparts and our federal public health counterparts. So we're all trying to work together, but absolutely, my constant concern is what is best for the health of Torontonians and how best do I achieve that within my authorities as Medical Officer of Health for the city. So as I have new plans and make new decisions in concert with our team, premised on the evidence that we have in front of us, our local data and local circumstances, and the changes in our environment, I will be sure to update you and the rest of the public as to what we're seeing and what we think is next needed in terms of action.
Okay, thank you. We go next to Melanie Zetter from Global News.
Hi there. Hi there, Dr. Davilla. Back at the May 22nd briefing, you spoke to a jump in cases on that day, and you suggested family gatherings over Mother's Day weekend, 12 days earlier, was likely to blame. So as we head into Thanksgiving weekend, when will Toronto Public Health have data that might point to families who chose to ignore your very clear advice?
Well, I'm hoping we don't have those data because I'm hoping that people will follow my very clear advice. I hope we don't get there, and I'm speaking quite honestly. I would really ask the people of Toronto, please follow this advice. It is the best advice if we wish to really protect the health of our community.
Are there any other holidays or large events that have happened over the last 7 months where you can look at the numbers and point to large indoor gatherings as a cause for a spike in COVID numbers?
So, I'd have to think back and really look at our data, but I can tell you this, of the reading that I've done, around the different write-ups and the situations, COVID-19 situations around the world, we do know that large gatherings have given rise to significant transmission and spread, some of which have been incredibly well written up. So, whether it's in Asia, we've seen a number of those events in the United States. And fortunately, to my reading, we haven't seen really those kinds of events in the Canadian context, and I'm hoping it stays that way. I trust the people of Toronto to make good choices. I know that they're concerned about, our health as a city, and so I would encourage them to follow the advice that we're providing, make good choices, and to continue to really practice self-protection measures, watching their distance, wearing a mask, washing hands, and staying away from others, isolating when you're actually symptomatic with illness.
Okay, next we go to Scott Lightfoot from CTV News. Scott, go ahead, please.
Thanks, Brad. Dr. Davilla, just to clarify and sort of follow up on what Matt Bingley had asked, the models that you showed, they show different scenarios with further actions being taken at certain dates. Can you just be more clear on what the actions are that need to be taken? I know you mentioned personal responsibility, things that people have been told to do for months, but are these models also factoring in the actions that you've called for, maybe some of the things you petitioned the province to do?
So let's be really clear, and I know this is a little bit nuanced, but when we're showing the models, what the models show are what happens at different levels of R. What it takes to get to those different levels of R it isn't specifically named in the models, or it's not accounted for in the models. All we're doing is changing the R level, presuming that actions have been taken to actually achieve those numbers. What specific actions will take something from an R currently of, say, 1.2 down to 1.1? I can't say until we actually adopt the action and see what happens. We won't know in practice what that really looks like. That's premised on assumptions. And that's always the issue with models. Models are only as good as the data that are used to build them and the assumptions that go into actually creating them. So these are projections, visions of the future, but they're not necessarily a sign of what will actually happen. The reality is what happens is actually up to each and every one of us. The more we practice good self-protection measures, and I know you've heard me say this before, you will hear me say it again, watching distance, wearing masks, and washing hands, staying home when we're sick, the more we're able to do that, the more we're able to make good choices around what actions we're going to engage in or what activities we engage in, the sooner we will be able to bring that R level down below 1. And we know when that R is below 1, the virus spread will die out.
Okay, so do you sort of look at these models as a warning, not just to Torontonians, but also maybe to provincial officials, sort of about what could happen if more things aren't done to stem the spread that you're seeing here in Toronto?
So that's exactly the value of these models, to give us a sense as to what we might expect if we are not able to bring the virus transmission down to a reasonable level where it no longer presents a risk or a threat to the health of the city. This is what we're trying to do by bringing models forward so that people understand that their actions, right, our actions together as a community is really what's at the heart of all of this.
All right, thank you. We go next to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi, Dr. Davilla. I'm wondering how you square the fact that the Ontario government is giving us an R level of 1.4, even higher than the city is with your modeling, but at the same time turning around and saying there's no need to grant you these extra limits on bars and restaurants and gyms. Those seem completely contradictory. How do you square it?
Well, I think, David, that the province has different considerations, right? They are thinking about an entire province, and for me, my purview and concern is limited to the city of Toronto. But my sense is that across the board, I have yet to run into anybody, whether it's at the local level of government, the provincial level of government, or at the federal level of government. I've yet to run into anyone who isn't concerned about COVID-19 and its impact on the people of whether it's the city, the province, or the country. So I think that we are all, united in an interest in doing the best we can in terms of fighting COVID-19. And I offer the best advice that I have to the residents of Toronto. I offer that advice and I consult with my provincial partners, and we continue to consult with them. I consult with partners all across the province, other medical officers of health as well. And I will do what is necessary, as I've spoken to earlier. I will do my very best to ensure that we are doing our best to protect the health of the residents of Toronto.
Thank you. And follow-up is on the positivity rate.
Say one thing, David. Sorry.
Yes, sorry. No, go ahead.
Simply to say that, every effort is being made as we speak, as has been done since the first day this became a pandemic, for the two governments and all the officials and experts to take account of all of this data. And it is sometimes adds to the complexity of it to have different sets of data and different numbers that are out there. But the work continues as we speak on trying to and as we've done very successfully during the pandemic to date, to try to forge a consensus of what is best to be done for the City of Toronto or for elsewhere in the province. And so your question kind of implied maybe we're just at a sort of stark, two poles that are not, but we're making a big effort, all of us together, to try and find the right answer to do the right thing. Dr. Davilla has offered her advice, and there are lots of discussions going on to try and square things, as you said.
Thank you. My follow-up question is about the positivity rate for tests that you mentioned earlier, Dr. Davilla. One area that jumped out to a lot of people was an area around Midtown near Yonge and Eglinton, where the rate is above 10%. I asked your unit what outbreaks have happened or what could account for that, because I've talked to local officials, including the city councillor, who don't seem to know. And they've just said they'll have to look and get back to me. Do you know what could account for that? And should there be a mechanism where it's very easy for people like me or anybody to see not just numbers for an area, but actual specific things about outbreaks in workplaces or other places?
So this is one of the points that I was trying to make in my remarks around having data. So we talked a little bit about, or I mentioned a little bit about percent positivity by neighborhood. And this is new data that the province has shared with us. And I think the data that are circulating out there right now is a small portion of data, completely taken out of context or with no context around it. And so it's very difficult to really interpret and understand what it truly means. So when I look at the data that we've received thus far, and it is very, very recently that we've received this percent positivity by neighborhood, we're taking a little bit of time and we're working on it as quickly as possible. But we want to make sure that as we put these data up, that the appropriate context and interpretation is provided so that it is not left to chance or to misinterpretation, because that's just too easy and it's inappropriate, and frankly, it may be unsafe, because if certain data are put out in a wrongful fashion, we may in fact compromise privacy. And I think that that's a really important concern that we have. So one, I think when we look at these data, it depends on the number of tests that are being done. There may be unique circumstances and reasons why tests are being done, but percent positivity is most useful when you're able to interpret it in a context where the tests are, where there's good and stable access to testing, and testing rates are also relatively stable. That gives you a sense as to what's really happening. When I look at the data, you know, there was a snippet of data, as far as I understand it, that were circulated largely on social media for a specific period of time, but with no context. I'm not sure that it's all that meaningful. So I would encourage people, we are working on getting those data up on our website as soon as possible to add to the number of cases and case rates by neighborhood, which we already have and have continued to post. So once we have percent positivity by neighborhood ready to go up to the website, that will be provided with context, with analysis, and in a way that we know is safe. And I think you'll be able to derive better conclusions premised on those data rather than on snippets that are available through social media.
Okay, final question is to Francine Copin from the Toronto Star. Francine, go ahead, please.
Oh, hi. My question is for Dr. Davilla. Dr. Davilla, the R rate in Toronto, TPH estimates is 1.2. The province says it's 1.4. It's beginning to sound inevitable that this autumn will be worse than the spring in terms of infections. Have we reached the point where that has become inevitable, that it will be worse in the fall?
You know, Francine, as I've tried to emphasize over and over again, our future is in our hands. I cannot say that enough. It's actually up to each and every one of us. The more we are able to really think about the choices that we're making and the activities that we choose to engage in, if we really reflect, are we doing the things that we need to do? Or are we doing things because we want to do them? Are we actually really doing the best we can in respect of adopting self-protection measures, watching our distance as much as possible, wearing our masks as much as possible, washing our hands as much as possible? These are the things that we can do that are effective. We have seen this in our own city. We have seen it in cities all around the province, all around the country, and all around the world. We know that these work. So I can't emphasize enough what the trajectory is from here onward is up to us.
And then a follow-up question, are the cases that you're seeing now creating the same kind of burden on the healthcare system that they were in the spring, or has there been some improvement there, and if so, why?
So a couple of things on that. For starters, we are generally seeing at this point a slightly younger demographic being impacted or represented in our cases relative to what we saw in the spring wave. However, in every jurisdiction that is ahead of us in respect of this outbreak, if community spread starts off in that younger demographic but is allowed to continue and perpetuate, it is just a matter of time before it gets into an older demographic and then has significant impact on that older demographic, which we know is more sensitive to more severe outcomes of COVID-19. The other element that is really important here is that hospitalizations and healthcare usage is what we characterize as a lagging indicator. You will need to see cases go up first, and it does take a couple of weeks at least before we start to see hospitalizations rise, as a consequence of increasing COVID-19 activity in a community. So again, I would emphasize to everyone in the City of Toronto, in order to best protect our entire community, but especially to protect those most vulnerable to COVID-19, older people in our community, those who have pre-existing medical conditions, in order to protect them, in order to continue to have as safe an environment for the operation of our schools, and in order to just have overall good community health, the better we are able to engage in self-protection measures and to limit our interactions with others that are outside of our household, the better we are able to control the spread of COVID-19 in our community, the better we'll be able to protect all these people that need this protection and to protect our healthcare system.
Okay, thank you for joining us, everybody. That concludes today's briefing. Please stay safe.